Welcome to You and Your Pets. I am Jim Horton, your host, and we're here with our resident expert, Dr. Ernest Rogers. And he is with a guest tonight, and our guest is Mocha. And Mocha is a
Sheltie.
A Sheltie.
And she belongs to a very good client named Miss Chen. And Mocha has a family of 3 people who lives with her.
That's very, very good. And how old is Mocha now?
Mocha is 7 months old, on the young side, the younger dog, to start our conversation.
And let me ask, just to get started now, with a dog that's at 7 months, have they already reached the point where they should be in maximum training, or is it's too early to train them at 7 months?
Well, actually, we can train them from the time they're young dogs. From 8 weeks or so, we can start working with them. Obviously, the attention span is shorter in a dog of 8 weeks, but we can get them to come, sit, stay. And Mocha is already trained at 7 months to come and sit. And I don't know if she's trained to stay, but she's a very, very well-trained dog for 7 months. So we can work with them from fairly early on and continue throughout their life.
Okay. Now let's turn to the conditioning and that we should be aware of with young dogs. Mocha came into her family just 7 months ago, and she was a young pup when she came into the family. What is it that an owner should be paying attention to with a young dog?
Well, I think what's really important when you adopt a dog into your family is to make sure that your lifestyle and the dog's lifestyle merge. The dog has to be trained to understand that meals occur at a certain time, times to go out to the bathroom occur at a certain time, training times occur, and that the dog should really be able to fit into that timetable for you. So it's really important that you work with the dog, give him or her a little bit of leeway. Hi, Mocha. Or give them enough consistency and repetition so that they can learn. Mm-hmm. That's what's important. That's the first thing in terms of getting your dog into a family situation.
So, and what about the really edgy thing of toilet training a dog?
Again, toilet training can be difficult. It really depends on how bright the dog is and how bright the owner is. It's a combination. But again, consistency and repetition are going to be the important keys. So even though on Saturdays you want to sleep in, you might not get to. For the first 5 or 6 months, you're really going to have to make sure the dog goes out at the same time every day. So that means on working days when you get up at 8 and you're out of the house by 9, you're going to have to take the dog out at 7:30 or 8. Same thing with on weekends, even though you might want to sleep in. So we work with them and we get them to get the same time every time. So that's the consistency. And the repetition is that they get to go out 3 or 4 times a day. That usually works and usually takes about 3 to 4 months before they're on their own and able to decide that I'm going to hold it for another couple of minutes.
And what kind of conditions should we be looking at given the breed of the dog? I know we were talking about that before the program started, that some breeds have particular conditions that you need to watch out for.
There are medical conditions for different breeds of dogs. Mutts are a little bit difficult to assess, but usually you go with the conditions that are most common for that dog. So dogs that tend to be large, German Shepherds, Rottweilers, big Mastiffs, we tend to think more of the hips and the joints as being an issue for them, particularly the elbows, hips, and knees. And there are certain criteria that we use to judge them as to whether or not they may or may not have problem. And those criteria are based on x-rays. Mm-hmm. We can take x-rays as early as 6 or 7 months, but the definitive assessment of an animal would be done at about 1 to 2 years for their hips. With other dogs, such as poodles and certain cocker spaniels, certain spaniels, we find that there's a possibility of a retinal degeneration or degeneration of the back of the eye. And in those cases, we tend to have them go to an expert, a veterinary ophthalmologist, and have them examined for the possibility of that and have them followed for the first couple of years to make sure that that isn't a condition that they're suffering from. There are other things that are specific to certain dogs. Dogs with floppy ears tend to have more problems with their ears, and we see that quite often. And so the veterinarian would examine their ears and try and educate the owner on to how to keep them clean. For anything that goes along with a purebred dog, there are ways of mitigating or preventing or reducing the severity of any problem that they could have.
So let's take a dog like Mocha. When she first came into the family, should she have an immediate visit with a veterinarian, or is obviously shots? I'm assuming she would have to have her shots, right?
Correct. Initially, when you get a dog, you want to take them to your veterinarian to be assessed as to whether or not there's a cardiac problem. Some dogs, unbeknownst to the breeder, can have a cardiac problem, so we want to have a thorough physical examination for a young dog. Then, of course, we have a series of vaccines. Now, depending on, again, the lifestyle of the owner, we will have certain vaccines. The basics are the rabies and the distemper. And then we follow it up with other vaccines depending on whether the animal is going into the woods, whether the animal is going to be boarded or going to kennels. So we will follow up with the various vaccines as are necessary. And of course, it's between 6 and 9 months, we like to have the animal spayed or neutered.
Okay, and the reason for that? I think you mentioned some rather disturbing statistics.
There are some disturbing statistics. The Associated or American Humane Society quotes 6 to 8 million dogs are given up at shelters every year. And of those, 50% are adopted, and unfortunately the other 50% are euthanized. So we really do have an overpopulation of animals, often not purebred, but we do see purebreds in these shelters. And so the neutering and prevention of reproduction of more animals, and for people who really don't need the animals or don't want to breed their animals, seems to be a reasonable thing for me to do, for me to expect an owner to do.
Okay. So after the shots, after the basic look and evaluation of the dog, what should happen, say, at the 1 year or year and a half period? Should the animal come back on a regular checkup in these first years, or?
Well, I think I'd like to go back a bit. I'd like to go back to when an animal is 3 weeks old. An animal who's 3 weeks old really has a very open mind. Between 3 and 15 weeks, they're very accepting of other animals, new places, new people, and different situations that otherwise and it's not a light switch, it doesn't turn off like a light switch, but after 15 weeks, they tend not to be as open and as plastic. So we like to expose them in that early age to as many things as we can. Tall men with beards, short men with hats, tall women, other dogs, other cats, so that they have an open mind about dealing with these, and they become much more easy to handle. They become less fearful and therefore less likely to bite.
And you mentioned some statistics on bites that had me rather surprised as well.
Well, the Humane Society of America states that there's approximately 4.7 million bites a year, of which almost 800,000 require hospitalization. So we really want to make sure that our dogs aren't fearful, they aren't aggressive, they're open to new situations, and the best way to do that is to expose them to lots of things at a young age. As they grow up, we can continue to expose them to new things, but it really is that 3 to 15 week period that makes a difference in a dog's life.
So if a dog becomes like a one family dog, doesn't like
Right.
any outsiders, that means that that animal probably was not exposed to outsiders in the first 3 to 15 weeks?
Not necessarily. Some breeds, particularly the Shiba Inu, tend to be one-person dogs or one-family dogs. Mm-hmm. And I have many Shiba Inus in my practice, and they're fine with me. So I think we can have dogs that are one-person, one-family dogs that still are accepting of other people outside. It doesn't mean they're going to be biters or fighters. It just means that they're going to prefer and be in their comfort zone when they're with one person.
Okay. Now let's take Mocha. What are the particular characteristics? Now she is a sheepdog,
Yes.
so my guess is she would have some sort of herding instincts with her.
I'm sure she does.
And she would probably watch out for her family very closely.
She would fit into a pack situation. Now, Mocha has has another dog at home named Java, and they tend to get along very well. The one thing that I notice about Mocha is that she will stay with her owner and prefer to stay with her owner, and she's doing a very good job of just being with me tonight, but she does prefer to be with her owner. Certain dogs have different instincts. These type of dogs, some of the Shetland sheepdogs, are herding dogs, and they will herd. And you'll find that you walk and they snip at your heels as you walk, and that's part of their herding instinct.
Yes.
Some of the guard dogs will sleep by the door and growl when people come by. That's part of their instinct. The sporting dogs will disappear following sheep or even deer or whatever wild thing happens to run in front of them. So they do have unique characteristics that have to be either enhanced if you want them to be a hunting dog, or diminished if you want them to be a family pet.
So a dog like Mocha, could she ever be off leash, or is she the kind that, and because she will stay with her owner, or would she be a dog like our family dog who forgets and takes off to the woods and doesn't remember what it is that he was supposed to be doing?
Well, I think in all cases with all dogs, training is of essence. Most dogs can be trained. I question the ability of Huskies to be trained to be off lead, but I have seen it done. I've had Huskies and I have many in my practice, and they tend to be wandering dogs. So yes, I think with a certain amount of training, patience, and the diligence of the owner, most dogs can be trained to go off lead.
Okay. Is there anything else about a young dog that we should know at this point?
Well, you were talking about their age at about 1 year, and I think that's an excellent point to continue with now. The one thing that we have that a dog does at 1 year is we have to expect that we're going to have 90% of their growth in most cases. And so we're going to see issues that might come up with their growth. In other words, I expected my dog to be 40 pounds and now he's 80 pounds. But realistically, by 1 year, you will have done and paid most of your veterinary bills. And that could be anywhere from $1,000 to $1,500 to $2,000, depending on what your dog needs. But between spaying and vaccinations and heartworm pills, you should expect to spend about $1,000 to $1,500.
Does a family really realize that expense before they get an animal the first time?
I don't know if they do. I try and make that clear to people, but often people come and see me after they've gotten their pet, so it's very difficult.
And all of a sudden they're saying, how come I have these bills?
Right. It is difficult, and nowadays we have many shelters that will spay and neuter the dog and give vaccines before they ever get to me. And in that case, it might be a little less expensive, but it's still going to be a chunk of a family's budget that they have to anticipate paying. And that doesn't include injuries or possible diseases that the dog might be exposed
Or
to.
food?
Or food.
Yeah, and I think Mocha is saying that it's about time for this session to end, which in fact it just about is about time. So I want to thank Mocha's owner for allowing her to appear tonight. She's been a very, very good dog.
She has.
And after the break, we'll have another dog that's coming in, a Bichon Frise by the name of Max. And so why don't we take a break now? I'm Jim Horton. I'm with Dr. Ernest Rogers, and we'll be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets. I'm Jim Horton, and I'm here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we have with us a mature dog and his owner, and this is Sarah, and the dog is Max. And tell us a little about Max, Sarah.
He's 11.
He's 11.
He's a good puppy. Well, I think he's a good puppy. Other people might disagree. He likes to jump on furniture and things like that, but otherwise, he's a good dog.
And a Bichon Frise.
Yes, he's a Bichon Frise.
And they were originally, I think, thinking way back, they were originally lap dogs for the French nobility.
And then they were circus dogs.
And then they were circus dogs.
Yeah.
And so they have all sorts of peculiar genes in them. And so, Dr. Rogers, let's take a look at Max. And he's 11. What is it that we should be paying attention to for a mature dog?
Well, maturity, let's talk about when maturity comes on to a dog. And I like to think that a dog is mature and should be examined as a mature dog between the ages of 5 and 7, depending on the dog. A larger dog might be a little bit younger than that, between 4 and 5. But when we consider a mature dog, they're generally fully grown, their bones have completely closed and there's no more bone growth. Their organs are working at maximum. And they're doing very, very well. And usually that's based on how they've been treated as a puppy, whether they've had good nutrition and been exposed to lots of exercise. And clearly Max has been exposed to good nutrition, lots of exercise. And though he's bored with my talking, he seems to be doing very well. He's well trained and he sits here very well. And so that's what we expect in a mature dog. A little less energy and a little bit more obedience.
Now, as Max gets older, what sort of things should we be looking for?
Well, at the beginning of the maturity cycle, which as I said, for between 5 and 7 for smaller dogs and 4 to 5 for older dogs or bigger dogs, I like to take blood work. That's part of the veterinary preventative health and preventative maintenance assessment. We'll take some blood and we'll assess how the organs are functioning. Now, in 90% of the cases, the organs are going to be doing just well, and we don't have any problems. Therefore, it's a baseline. 2 years after that, we'll take another one, and we'll see if anything has changed. This is our early warning system for kidney disease, liver disease, heart disease, and other kinds of diseases that these older patients can get. So initially, we like to do blood work. X-rays are necessary throughout the dog's life, and we like to keep a record of those and see how the dog is developing. Certainly mature dogs can have problems with things such as hips, ears are often a problem, and you start to see that their eyes are a little bit cloudy, and that's normal aging changes in a dog. Mm-hmm. They need dentistries, more so at an older age, because the tartar, or the brown stuff that accumulates on their teeth, will push their gums up and cause gingivitis, and as we all know, gingivitis causes us to lose teeth.
Right.
It also hinders our nutrition. So we like to do dentals on a regular basis, probably more so on dogs before they get too old. So those are the things that I really key in on. We like to make sure they don't have parasites, so we do fecals as we do in younger dogs. But fecals in the older dogs tend to be more as a baseline again and as a look-see rather than really expecting to see any parasites.
Well, speaking of that, I would assume that if it was an outside dog, Max is an inside dog, pretty much. He outdoors to him is he goes, but he prefers lying on his sheepskin. But if it was an outside dog versus an inside dog, wouldn't you have more troubles with things like parasites as the older they get, simply because they get into more stuff out in the land as they're running around?
Well, any dog, most dogs go, even though they're inside dogs per se, they do go outside to pee and poop. When dogs go outside, they can walk through other dogs' poop, they can sniff other dogs' poop, they can run through the backyard, pick up ticks, pick up fleas, and certainly they're still exposed to all the same parasites. I agree, dogs that tend to stay outside or are hunting dogs tend to be exposed to more parasites. But whether it matters is sort of a question that I can't answer. I think all dogs have to be checked for parasites, whether it's fleas, ticks, or internal parasites such as roundworm, hookworm. And in all cases, they're going to be exposed in some way. It's a question of how likely they are to be exposed. But if they're not exposed, that would be an unusual dog.
How does an owner know that the dog may have that kind of a problem?
Frequently, and the problems vary, of course. Ear problems, we often have stinky ears with lots of wax, and the dog might be scratching at it.
Maxie has that problem, yes.
Maxie has been treated for that problem a couple of times. Bad teeth, often we have halitosis or bad breath, We may also see the browning of the teeth, and the gums are red, and we might often see blood in the water when they drink. Hip problems, that we might be seeing, they resist going up the stairs, they occasionally have limps, they resist jumping into the car, jumping on a bed. Something more common, and I think this is what you wanted me to address, internal parasites. Internal parasites sometimes have absolutely no symptoms. Other times you see off and on diarrhea, off and on constipation, sometimes vomiting, and very occasionally you will see worms in the poop. In terms of heartworm disease, which is another internal parasite, but floats in the blood, there really are very few symptoms of that. For external parasites, often you may see or have the dog be very scratchy, or you may actually see a flea or a tick on the dog. But again, that's more unusual.
Do they get diseases from ticks like humans do?
Certainly. Dogs and cats both get diseases from ticks. The diseases are numerous. We can identify probably 8 or 10 of them, but there might be 20, 15 or 10 that we can't identify. But the biggest one that people know about is Lyme disease. In cats, we also have Lyme disease. In dogs, we can have Rocky Mountain spotted fever from ticks. From fleas, we can get tapeworms, and we can get Bartonella. Bartonella is cat scratch fever, and certainly that's found more often in cats, but it can occur in dogs. And so, yes, we can have different diseases transmitted. As you know, a heartworm is spread by mosquitoes. And so we know that heartworm can occur in a dog, and it affects a dog's heart. And it can also occur in cats, though it seems to be a less serious disease affecting the lungs.
So if you're in an area that, for example, where we live, there are a lot of deer
Yes.
that come around, and they are natural tick carriers. So one should be, I would assume, much more careful if you have a lot of wild animals that are parading across your backyard or that sort of thing.
Correct. You'll notice that a lot of wild animals are what we call vectors for disease. In other words, they carry something that allows that tick or that mosquito or that bug, whatever it is, to develop a disease that can then be passed on to humans or to dogs. We know that, for instance, deer do carry ticks that can carry Lyme disease and Rocky Mountain spotted fever, but other rodents and snails also can be vectors or intermediates for the host, which is the dog or the human, to get a disease.
All right, and really the only safety in all that is to have them examined regularly, basically.
I think to have them examined, but the pet owner has some responsibility for looking at the dog on a daily basis and seeing whether or not there is any evidence of ticks or tick bites, and then clearly the use of tick preventative, flea preventative, heartworm preventative is all in the dog's best interest, and the owner can come to the veterinarian for both testing, for examination, and to get the preventative medicines.
Okay. So let's turn now to Max. He's 11, and as he ages, what are the systems in a dog his size that have a tendency to get into trouble that an owner should be aware of?
Well, I think typically it depends on the dog. Some breeds of dogs have more cardiac problems, such as the miniature Schnauzer. Other breeds of dogs have more eye problems, the Poodle and the Cocker Spaniel. Some other dogs, the larger dogs, will have more hip problems. So really it depends on the particular breed of dog. In Max's case, I would be more concerned about his ears than anything else, and his dentition, his teeth. Certainly those are things that we want to keep an eye on. Cardiac disease is possible if he gets heartworm. And then, of course, the big system that we always worry about and have a difficult time protecting and evaluating is the immune system. The immune system is the system that helps protect us against bacteria, protects us against viruses, protects us against cancer. And as the immune system breaks down, those diseases become more prevalent, and we see that in the very oldest of the dogs, 19, which would be a fairly old dog, although I've heard there are records of dogs as old as 27, but anywhere between 16 and 19, fairly old dogs. When the immune system breaks down, we tend to see the diseases such as cardiac disease, cancer. We can also see liver disease, kidney disease is a big one, both in dogs and cats.
And when does the immune system start to break down?
I don't think there's a date or a time or a label or a UPC code that we can examine
So
to
it just
find that out.
happens.
It happens slowly and depends on the dog's maturity, but also depends on the dog's early life, the nutritional status of the dog, how well it's been taken care of, how many diseases it's had as a young dog. I mean, clearly the young dog that has lots of parasites is more likely to have problems later on. But there's no time for breaking down, and not all dogs have their immune system degenerate. Some dogs have a cardiac problem, as I said, and their immune system's fine, but they have problems with their heart, called congestive heart failure, and we see that in humans.
Okay. Well, that pretty much wraps up our program for the night. Sarah, I want to thank you very much for bringing Max. He has behaved himself nobly, which I didn't think he had in him.
He tried his best.
He tried his best. That he indeed did.
Good boy, Max.
And for an 11-year-old, he is actually
He's a specimen.
He's a specimen. He's acting nobly tonight. So I want to thank you for having him here, and I want to thank you again, Dr. Rogers, for
Thank you.
talking with us on You and Your Pets. And I want to thank you for watching. And this is You and Your Pets. I'm Jim Horton, and we'll see you next time.